Patients are considered for lung transplantation if they have end-stage pulmonary disease or end-stage pulmonary vascular disease.
On our first visit with a patient, there are several items that we have to discuss and think about. First and foremost, we find out if the patient has a lung disease that's severe enough to warrant consideration for lung transplant. And along those lines, we have to think about whether there are alternatives, medications, other types of procedures that might help us better understand their disease and figure out alternatives, therapies for treatment.
And then at that point, the doctor determines if they're a good candidate for transplantation. Based on that, they would go through a series of testing, and that is to make sure that they are healthy enough to undergo the transplantation, where they're going to remove a native lung and then put in a donor lung. So that's a big undertaking. We have to make sure that the patient has no other risks. Heart disease, so they have to maybe go through a cardiac catheterization, a VQ scan, which looks at how much air goes to each of the lungs as well as the blood flow to the lungs.
We have them meet consultants in infectious disease and with our surgery team, a dietitian, a psychologist, and a social worker. We need to really understand that whole person, both their medical and their psychosocial side as well, because all of this is going to come into play both before and after the surgery in both the short term and in the long run.
Going through transplantation surgery is a huge undertaking. It requires a very involved support system. Patients cannot do it alone. They have to have their family or friends rally around, and for an extended period of time after transplantation. Patients that don't have that support system do not do very well. And so it is important that the support system is active and involved and present for that whole procedure. And it starts from the very first day that they come to clinic. We have to have that support system there and present and available. And then we start education process from the very first time that they come to the first appointment. We start educating them about the process of what transplantation is, what the expectations are, what the testing is.
We ask the patients and their families to go through a couple of education classes where they meet our staff, and they also meet some other patients who are considering transplant as an option. Together, those patients learn about what all goes into it, again, what are all the tests that are going to prepare them for the surgery, as well as what to expect afterwards, whether it be the medications, whether it be some of the possible complications, whether it be the plans for frequency of appointments and bronchoscopies and other tests, what all the medications are going to be like, how many medications to expect. So there's a very elaborate education process that is sometimes also supplemented by attendance by the family and patient at our support group, where patients who have already received transplants, either recently or many years ago, can advise you and your family about what to expect, what kind of problems to expect, what kind of quality of life to expect in the years after the transplant.